Hello nurses, how are you all, and welcome back to my channel Nurse Navigator Swati. I am back with the fourth part of Obstetrical and Gynecological Nursing MCQ question and answers. Quickly go through my part 1, 2 and 3, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1, normal labor is called. Options are spurious labor, dystocia, eutocia or option 4 false labor. Yes, eutocia is a medical term defining normal, natural childbirth or labor characterized by its continuous onset at term, vertex presentation and completion without major complications or significant intervention. So here option 3 is the correct answer. Question number 2, show is the sign of. Options are true labor pain, false labor pain, sign of abnormal labor or option 4 sign of placenta previa. Yes, you are absolutely right. Show in pregnancy is a sign that the cervix is beginning to soften, thin and dilate in preparation for labor. So it is a sign of true labor pain. So option 1 is the correct answer. Question number 3, the process of giving birth is called labor, lightening, postpartum or option 4 parturition. In medical terminology, parturition is the biological process of giving birth to offspring marking the end of gestation, which is also called in common language childbirth or labor. So here according to medical terminology option 4 is the correct answer. Question number 4, what is the normal dilatation of cervix? Options are 20 cm, 10 cm, 7 cm or 50 cm. Yes, you are absolutely right. Cervical dilatation is the gradual opening of the cervix from 0 to 10 cm during labor, allowing for vaginal delivery. So here option 2 is the correct answer. Question number 5, what are the indications of cesarean section? Options are fetal distress, central placenta previa, obstructed labor or option 4 all of the above. Yes, fetal distress obviously a indication of cesarean section, central placenta previa which can lead to premature separation of placenta, this is also an indication of cesarean section, and the obstructed labor obviously a indication for cesarean section. So here all of the above is the correct answer. Question number 6, when is fertilized ovum is known as embryo? Options are 0 to 8 weeks, 0 to 12 weeks, 12 to 24 weeks or option 4 8 to 32 weeks. From 0 to 8 weeks after fertilization, it is called an embryo. But from 9 weeks after fertilization until birth, it is called a fetus. So here option 1 is the correct answer. Question number 7, specific manifestation in menopause is. Options are hypotension, hypothermia, hot flushes or option 4 anorexia. During menopause, hot flushes are sudden feeling of warmth primarily in the face, neck and chest that is accompanied by sweating and rapid heartbeat which is caused by fluctuating hormone. So here hot flushes is the specific manifestation in menopause. Next question, hormone responsible for hyperemesis gravidarum is. Options are progesterone, human chorionic gonadotropin hormone, relaxing hormone or option 4 human placental lactogen. Yes, you are absolutely right. Human chorionic gonadotropin hormone that is HCG hormone is the main responsible for hyperemesis gravidarum in first trimester. So option 2 is the correct answer. Question number 9, which out of the following is not a feature of preeclampsia? Options are edema, hypertension, fits or option 4 proteinuria. Preeclampsia is a serious pregnancy-related disorder occurring after 20 weeks and it is characterized by presence of edema, high blood pressure that is more than 140 by 90 mm of Hg, protein in the urine. But fit or seizure will be associated with eclampsia. So here option 3 is the correct answer. Question number 10, morbidly adherent placenta is called as. Options are placenta accreta, option 2 placenta succenturiata, option 3 placenta circumvallata or option 4 battledore placenta. Placenta accreta is such a condition where the placenta grows too deeply into the uterine wall that often causing severe hemorrhage. So here option 1 is the correct answer. Question number 11, attitude of fetal head occipito-posterior position is. Options are flexion, deflection, extension or adduction. In a occipito-posterior position, the fetal head is typically in a deflexed position or purely flexed attitude. So here option 2 is the correct answer. Next question, ortholanase test is diagnostic in. Options are respiratory distress, congenital anomalies, congenital hip dislocation or option 4 induction of labor. Yes, the ortholanase test, it is a physical examination maneuver used to detect developmental dysplasia of the hip in infants, typically under 3 months old baby. So here option 3 is the correct answer. Next question, postpartum hemorrhage is loss of blood which is more than, options are 200 ml, 300 ml, 400 ml or option 4 500 ml. Yes, postpartum hemorrhage or PPH is generally defined as a cumulative blood loss of 500 ml following vaginal delivery within 24 hours of birth. So here option 4 is the correct answer. Question number 14, maternity nurse must be aware that screening for diabetes mellitus in pregnancy is done at, options are 6 to 17 weeks, 18 to 23 weeks, 24 to 28 weeks or option for 29 to 32 weeks. The screening for the gestational diabetes, it is typically performed between 24 and 28 weeks of pregnancy. This timing is mainly chosen because hormone level that causes the insulin resistance increases during the second trimester. So here option 3 is the correct answer. Question number 15, neonate of diabetic mother is at risk for all of the following except, options are hypoglycemia, hypocalcemia, hyperglycemia or option 4 hyperbilirubinemia. Within the given options, neonate of diabetic mother is at risk for developing hypoglycemia, hypocalcemia or hyperglycemia, but the chances of developing hyperbilirubinemia is very less in case of neonate of diabetic mother. So here option 4 is the correct answer. Question number 16, nurse is about to catheterize bladder of a pregnant lady. She should aware that all of the following facts about the female urethra are true except, options are it is about 1.5 inches in length, it is posterior to the vaginal orifice, it pierces through urogenital diaphragm or option 4 it is straight and offers minor resistance for catheterization. The female urethra is about 1.5 inches in length, it pierces through the urogenital diaphragm and it is straight and offers minor resistance for catheterization, and also it is located anterior, that means in front to the vaginal orifice, not posterior. So here option 2 is the correct answer. Question number 17, genital herpes simplex increases the risk of developing which cancer? Options are uterine cancer, option 2 cervical cancer, option 3 vaginal cancer or option 4 ovarian cancer. Genital herpes simplex, particularly HSV2, is heavily linked to a higher risk of developing cervical cancer. So here option 2 is the correct answer. Next question, compression effect of gravid uterus on the inferior vena cava result in, options are supine hypotension syndrome, option 2 carpal tunnel syndrome, option 3 HELP syndrome or option 4 supine hypertension syndrome. The compression of the inferior vena cava by a gravid uterus, especially in the supine position, restricts the venous return to the heart, that leading to reduced cardiac output and hypotension, which is commonly known as supine hypotensive syndrome. So here option 1 is the correct answer. Question number 19, a late complication of molar pregnancy is, options are uterine perforation, choriocarcinoma, option 3 shock or option 4 coagulation failure. Yes, you are absolutely right. Choriocarcinoma is a serious malignant complication of molar pregnancy. It occurs when an abnormal trophoblastic cells from the molar pregnancy become cancerous, invading the uterine wall and potentially spreading to the other organs. So here option 2 is the correct answer. And the last question of this quiz session is, which of this is an alarming sign of preeclampsia? Options are proteinuria of +2, option 2 blood pressure of 150 by 90 mm of Hg, option 3 edema grade of +2 or option 4 deep tendon reflexes 4+. A deep tendon reflex grade of 4+, it is an alarming sign of severe preeclampsia indicating extreme central nervous system irritability or hyperreflexia. So here option 4 is the correct answer. So let me know how much you have scored from this video and also mention me in the comment the topic on which you want more MCQs and explanations. See you soon in my next nursing quiz session.